reflects how a child becomes aware of the symmetry of their body and its relation to the space around them. When this particular skill is developed, often the child will have the ability to consistently use one side of their body to execute a task. By conducting themselves in that way, it makes the task more efficient, easier, and usually they will also develop by that time a dominant hand or foot. By Miley's age, children should almost be completely developed in this area, or have at least most signs toward full development.
Okay, and how is Molly doing with this?
Well, as you said, Molly's teacher complains often that Molly experiences left-right confusion and some like B and D reversals. At Molly's age, this is slightly delayed behavior. This testing done today confirms that Molly struggles with the ability to integrate that information in front of her. Since she's slightly behind in this area, you and her teacher are seeing these manifestations in school.
Okay, can we do anything to help her, or can this be fixed somehow?
Well, I know you said that Molly, she's never formally tested, right? By the
Right, no.
Disabilities Unit?
Correct.
Okay. Or any other professional?
No.
Okay, well, my first recommendation is getting Molly tested for a learning disability, either by the school psychologist, or if you don't want to go through the school system, I could recommend and point you in the right direction for a professional outside.
Okay.
If you also, I'd like Molly to come back after she's had the testing, so that we could test her for any additional visual skill deficits that could be contributing to the learning problem.
Okay.
Okay, or her, learning difficulties in school. If at that point we think that there are other visual things that are contributing to this problem, then we can help that here by vision therapy. But that's something we discussed earlier time.
Okay, so she might have to be doing a few different things.
Yeah.
Okay.
Alrighty. Do you have any other questions for me? Or are you confused about anything from today?
No, I'll see how it is next time we come back.
Okay. Great.
Piaget's specification of particular operations provides the optometrist with benchmarks with which to determine the appropriateness of certain visually directed behaviors. The progression of behavior from egocentric to behaviors more related to the environment is a generalized characteristic of many aspects of child development. As the child matures, there is less dependence on motor activity and more dependence on vision. Piaget's view of development of representational space states that the individual utilizes topological space first. One aspect of the topological operations that Molly demonstrated was proximity. This getting close to phenomenon is exhibited by many young children when writing or drawing. Older children who utilize getting close to when drawing simple figures of the Giselle copy forms exhibit behavior reflective of a depressed level of visual cognitive development. They must use vision to constantly monitor their performance to see what they're drawing. The second quality of topological operations, homomorphism, refers to an expected gross equivalency of form in a child's early representations. Closed figures are drawn with more circular characteristics, like Molly. Homomorphism can also be used to explain why children in kindergarten and early grades reverse letters and numbers when writing. The essence of homomorphism is that the child is so involved with the physical characteristics of the number or letter that they don't consider the spatial, directional attributes. This can be used to point out a developmental lag or deficiency in older children who continue to reverse letters or numbers, as Molly did. This child should have more advanced operations at their disposal. The child then advances to the projective space. Body or paper tilting behaviors are exhibited here during the drawing of geometric figures or writing of letters that have oblique components. Molly demonstrated this as well. But it is important to remember that projective behaviors are more advanced than topological ones, so by comparison, a child who shows a lot of body or paper tilting might be at a more advanced cognitive level than a child who does not. Projective techniques, however, are limiting in that they require the child to choose only one perspective out of many that are possible between themselves and the object. The Euclidean space is last, and the child utilizes and coordinates more and more of these lines of space, and their ability to work within a total spatial area improves. At the more immature level, they must actively relate back to their body organization. This is manifested in reversals, body tilting, and paper rotation. But as they mature, they understand their body organization as foundational and are able to handle spatial phenomena in a purely visual manner without utilizing body tilts. For children above 9 years who demonstrate either topological or projective behaviors in situations where Euclidean operations would be developmentally expected, the use of projective behaviors as a therapeutic intervention can be a powerful clinical tool. If a child is using only topological operations, the optometrist can show them the benefits of aiming or tilting. This can enable the child to more effectively impose an organization upon some quantity of space.